Hi everyone, how are you today? My name is Bertie. Thank you for learning psychology with me. Today we will talk about schizophrenia. We will talk about three words actually. What is schizophrenia? What are the causes? What are the symptoms? And most importantly, what are the treatments? What is schizophrenia? It's a complex brain disorder. Schizophrenia affects approximately 24 million people, or 1 in 300 people worldwide. Onset is most often during late adolescence and the 20s, and onset tends to happen earlier among men than among women. What are the causes of schizophrenia? Genetic risk factors and environmental risk factors. For example, the genetic risk factors, some potential risk genes, regulator of G protein signaling 4, disrupted in schizophrenia 1, dystrobrevin binding protein 1, and neuroglin 1. Environmental risk factors include stress and mental health, maternal stress during pregnancy, complications during labor and delivery, which can cause damage to the brain, and then drug use, for example, cannabis. With regards to neurotransmission, there are two neurotransmissions related to schizophrenia. Dopamine neurotransmission, there is a dopamine overactivity in schizophrenia disease. There is also dysfunction in glutamate neurotransmission. What are the clinical symptoms of schizophrenia? Positive or psychotic symptoms consist of delusions and hallucinations. Negative symptoms, which are changes in emotional state, loss of motivation and feeling. For example, reduced expression of emotion, less ability of experiencing pleasure and completing plans. Cognitive symptoms, hard to function independently. For example, in terms of memory, thinking ahead or thinking critically, sustaining attention, and problem solving. There are also other conditions. For example, there are symptoms of depression and anxiety, substance abuse problems, smoking, as well as other diseases, lifestyle factors, difficulty to healthcare access, and medication effects. PET scan. Brain scans of people with schizophrenia show several structural differences throughout the brain, including white and gray matter. You can see here the picture on the left-hand side. Changes to white matter. Reductions in white matter in the frontal lobe before and after diagnosis and treatment. Increase in another type of white matter called interstitial white matter neurons below the cortex. Changes in white matter related to psychotic symptoms and a lower ability to think in people with schizophrenia. Besides changes to white matter, there are also changes in the gray matter that include thinning throughout different parts of the brain's cortex, reduced gray matter surface area and volume. Changes in gray matter are linked to changes in cognitive thinking and motor or movement functions. These functions include storing and retrieving verbal information. What are the treatments for people having schizophrenia? Drug therapy, for example, antipsychotic medication, first generation or typical antipsychotics, chlorpromazine and haloperidol. Second generation or atypical drugs, clozapine. Psychological therapy, such as cognitive behavioral therapy or CBT, that can help you identify the thinking patterns that are causing you to have unwanted feelings and behavior, and then learn to change this thinking with more realistic and useful thoughts. Family therapy. It's also important that the family also takes part in the therapy in order to be able to support their family members having problems with schizophrenia. Art therapy. Art can also help you dealing with schizophrenia. Social support. It's important to be able to get the support from your social environment or your friends and your community. Stress management. Relaxation technique. These treatments are supposed to help with the schizophrenia. Thank you for watching my video today. Hopefully you learned some things about schizophrenia. See you next time.